What if I told you that most men are only getting 50% of the potential benefits from their Tadalafil? As a urologist with over 15 years of experience, I've discovered that simple adjustments in timing, diet, and lifestyle can dramatically enhance medication effectiveness, turning disappointment into satisfaction. Today, I'm sharing the science-backed secrets that pharmaceutical companies don't advertise. Hello and welcome to today's video. As a board-certified urologist who's treated thousands of patients with erectile dysfunction, I've seen firsthand how life-changing the right treatment can be. Tadalafil, commonly known by the brand name Cialis, has helped millions of men regain confidence and satisfaction in their intimate lives. But here's what many doctors don't take the time to explain. This medication isn't a simple on-off switch. Its effectiveness depends greatly on how you use it and the choices you make before and after taking it. Many men who think the medication isn't working for them are actually missing key optimization strategies. Today, I'm sharing 10 proven tips based on clinical research and patient experience that can help you maximize Tadalafil's effectiveness. These aren't theoretical suggestions. They're practical adjustments that my patients have used to transform their results from mediocre to exceptional. Tip number 1. Optimal timing strategies. Let's start with timing, which is absolutely crucial for Tadalafil. While marketing often emphasizes the 36-hour window, the reality is more nuanced. Tadalafil reaches peak concentration in your bloodstream about 2 hours after taking it, with optimal effectiveness between hours 2 and 12. Many men make the mistake of taking it just before intimacy and then feeling disappointed when results aren't immediate. For as-needed dosing, I recommend taking it about 2 hours before anticipated intimacy. For those on daily doses, typically 2.5 milligrams or 5 milligrams, consistency matters more than timing. Taking it at the same time each day maintains steady blood levels. And here's a key insight many miss. Tadalafil works by enhancing your natural arousal response. It doesn't create desire or erections without stimulation. Planning ahead doesn't reduce spontaneity. It actually enables it by ensuring you're physiologically ready when the moment feels right. Tip number 2. Food interactions matter. What you eat can significantly impact how well Tadalafil works. Unlike some medications that must be taken on an empty stomach, Tadalafil absorption isn't heavily affected by food, but certain foods can enhance or diminish its effects. High-fat meals can delay absorption, potentially pushing back that optimal effectiveness window. On the other hand, foods rich in nitric oxide precursors, like leafy greens, beets, watermelon, and pomegranate, can complement Tadalafil's mechanism of action by further improving blood vessel dilation. The grapefruit warning you see on many medications applies here too. This fruit and its juice can increase Tadalafil concentration to potentially unsafe levels by inhibiting the enzyme that metabolizes it. For best results, I recommend taking Tadalafil with a light meal that's low in fat but rich in those nitric oxide boosting foods. This isn't just theory. Patients who make these dietary adjustments consistently report better outcomes. Tip number 3. Hydration is critical. Proper hydration is one of the most overlooked factors affecting Tadalafil's effectiveness. Your blood volume and circulation directly impact how well the medication distributes throughout your body. Even mild dehydration can reduce blood volume, diminishing the drug's effect where it matters most. I recommend drinking at least 16 ounces of water when taking Tadalafil and maintaining good hydration throughout the day. If you're planning to consume alcohol, which I'll discuss more later, additional water becomes even more important as alcohol causes dehydration. How do you know if hydration might be affecting your results? Signs include darker urine, dry mouth, or feeling thirsty. Many patients who were disappointed with their initial results have seen significant improvements simply by ensuring proper hydration before and after taking their medication. It's a simple adjustment with potentially dramatic benefits. Tip number 4. Exercise timing and intensity. Strategic exercise can significantly enhance Tadalafil's effectiveness by improving circulation and boosting its primary mechanism of action. Moderate aerobic activity about 30 to 60 minutes before taking Tadalafil can enhance blood flow throughout your body, including the genital region. Activities like brisk walking, light jogging, or cycling at a moderate pace are ideal. Specific pelvic floor exercises can also enhance effects by strengthening the muscles that help maintain erections. However, timing matters. Intense workouts right before intimacy can actually redirect blood flow to major muscle groups and away from the genital area. Extremely vigorous exercise can also cause temporary fatigue that counteracts benefits. I've had patients transform their results by incorporating a moderate 20-minute walk into their routine before taking their medication. That said, those with cardiovascular conditions should consult their doctor about safe exercise recommendations when using Tadalafil. Tip number 5. Stress management techniques. The mind-body connection is powerful when it comes to erectile function, and even the best medication can be overridden by psychological stress. Stress triggers the release of adrenaline and cortisol, hormones that constrict blood vessels, directly counteracting Tadalafil's vasodilating effects. Developing simple stress management techniques can dramatically enhance medication effectiveness. Deep breathing exercises, mindfulness meditation for just 5 to 10 minutes, or even a warm shower can activate your parasympathetic nervous system, the relaxation response that optimizes blood flow. Some patients find that setting aside 15 minutes of quiet time before intimacy makes a noticeable difference in their response to Tadalafil. Remember, anxiety about performance creates a negative feedback loop that can override medication benefits. Breaking the cycle through stress reduction techniques isn't just psychological. It creates the physiological conditions that allow Tadalafil to work optimally. Tip number 6. Sleep quality connection. Sleep quality has a direct impact on sexual function and Tadalafil's effectiveness that many men overlook. Poor sleep affects hormone levels, particularly testosterone, which plays a crucial role in sexual response. Sleep deprivation also increases stress hormones that constrict blood vessels and reduce nitric oxide production, directly counteracting Tadalafil's mechanism of action. Research shows that men who regularly get less than 6 hours of sleep have significantly lower testosterone levels. I recommend prioritizing 7 to 8 hours of quality sleep, especially on days you plan to be intimate. Simple sleep hygiene improvements like reducing screen time before bed, keeping your bedroom cool and dark, and maintaining consistent sleep-wake times can enhance both your natural function and medication response. Patients who address sleep issues often report that the same dose of Tadalafil suddenly works much better. Evidence of this powerful but often ignored connection. Tip number 7. Medication interactions to avoid. Certain medications can significantly reduce Tadalafil's effectiveness or create potentially dangerous interactions. Nitrates, found in medications for chest pain, can cause dangerous blood pressure drops when combined with Tadalafil and should never be taken together. But beyond these well-known contraindications are medications that can reduce effectiveness without posing safety concerns. Some antidepressants, particularly SSRIs, can counteract benefits. Certain blood pressure medications, especially alpha blockers, can interact with Tadalafil and require dosage adjustments or timing separation. Even some over-the-counter medications and supplements can affect results. Certain antihistamines have mild anticholinergic effects that can impair erectile function. Always provide your doctor with a complete list of all medications and supplements you take. Sometimes, simple adjustments to dosing schedules can minimize interactions while maintaining the benefits of all your necessary medications. Tip number 8. Alcohol consumption guidelines. Let's talk about alcohol, a factor that significantly impacts Tadalafil effectiveness for many men. While moderate alcohol might help with relaxation, excessive consumption directly interferes with erectile function, potentially negating medication benefits. Alcohol acts as both a nervous system depressant and a dehydrating agent, reducing sexual sensitivity and decreasing blood volume. Research shows that blood alcohol concentrations above 0.08%, typically 3 to 4 drinks, significantly increase the risk of erectile difficulties, regardless of medication use. If you choose to drink, I recommend limiting consumption to 1 to 2 standard drinks and maintaining extra hydration. Timing also matters. Alcohol's effect on sexual function is most pronounced during the ascending phase, when blood alcohol is rising. Some patients find better results by having a small drink after intimacy rather than before, or by ensuring at least 2 hours between their last drink and intimacy. These simple adjustments allow you to socialize without compromising medication effectiveness. Tip number 9. Lifestyle modifications for enhanced results. While Tadalafil can help overcome erectile difficulties, certain lifestyle factors create a foundation that either supports or undermines its effectiveness. Smoking is particularly detrimental, as it causes vascular damage and reduces nitric oxide, the exact chemical Tadalafil works to enhance. Even occasional smoking can reduce effectiveness. Quitting can dramatically improve response. Weight management also plays a crucial role, as excess weight contributes to conditions like diabetes and vascular disease that complicate erectile function. Even modest weight loss of 5 to 10% can improve medication response. Regular exercise beyond pre-intimacy activity creates cumulative benefits for vascular health. These changes don't need to be drastic. Small, consistent improvements yield significant results over time. I've seen patients who initially needed the maximum tadalafil dose able to achieve the same results with lower doses after implementing these lifestyle modifications, demonstrating their powerful impact. Tip number 10. Communication strategies with partner. The final tip may be the most important. Effective communication with your partner. Tadalafil creates physical potential, but emotional and relationship factors remain critical for satisfaction. Partners who aren't included in the treatment process may misinterpret medication use or have unrealistic expectations. Open conversations about timing needs, response patterns, and preferences can transform the experience for both partners. Some men find it helpful to explain that arousal happens more naturally with this medication rather than on demand. Partners can help create an environment of relaxation and reduced performance pressure. Many couples discover that focusing on overall intimacy rather than specific outcomes reduces anxiety and actually improves physical response. I've seen countless patients achieve breakthrough results after including their partners in the optimization process, proving that while tadalafil works on physical systems, its benefits are experienced within the context of a relationship. By implementing these 10 evidence-based strategies, you can maximize tadalafil's effectiveness and transform your experience with this medication. Remember, optimal results come from addressing both the physiological factors, timing, hydration, diet, and exercise, and the psychological components like stress management and communication. Most men see significant improvements within the first few weeks of applying these techniques, though some lifestyle modifications may take longer to show their full benefit. While tadalafil can be remarkably effective on its own, these optimization strategies can be the difference between disappointment and life-changing results. As always, maintain regular communication with your healthcare provider about your treatment experience and any adjustments you're making. Every person responds differently, and your doctor can help personalize these approaches for your specific health situation. Thank you for watching this comprehensive guide. I hope these practical tips help you achieve the best possible results with your treatment. If you found this information valuable, please subscribe to our channel for more evidence-based health information. Remember, erectile dysfunction is a medical condition deserving of effective treatment, and with the right approach, most men can experience significant improvement. Here's to your health and well-being.